Hi, my name is Jessica Snyder. I'm going to be performing my head-to-toe assessment. So first, I'm going to scan the room to make sure you guys can see that there's no one else in here. Down. Okay. Okay. Hi, my name is Jessie. I'm going to be your nurse today. I'm just going to wash my hands first and close the curtain for some privacy. Could you please state your name and birth date?
Emma DeYoung, 9496.
Okay, and her age appears as stated. And do you know why you're here today? Do you know where you are?
I'm the hospital.
Okay, and what year is it?
2016.
Okay, so my patient she's awake, she's alert, and she's oriented ×3. And she has, do you have any pain or allergies?
Nope.
Nope. Okay, so there's no obvious signs of any illness, and her overall hygiene appears to be good, and her mood is good, her speech is clear, and her affect is intact. And today I'm going to be performing a head-to-toe assessment on you. So is that all right?
Mm-hmm.
Okay, and you just let me know if you have any pain at any time, okay?
Okay.
All right, so first I'm going to be inspecting her hair. I'm going to be checking for even distribution. I'm going to be checking for any lesions, any masses, any abnormal findings. Next, I'm going to be checking her face, checking to see if her face is symmetric, checking the temperature of her face, checking to see if there's any moles, and if there are any moles, I'm going to be using the ABCDE method, which is A is for asymmetrical, if the mole were to be symmetric or not, B for the border, C for the color, D for the diameter, and E for if the mole is elevated or not. So my patient does not have any moles, so we don't need to check for any of that. Next, I'm going to inspect her mouth. Could you open wide for me? Could you say ah? And her uvula, it rose when I told her to say ah, so that's good. And could you move your tongue for me? And could you say, or open wide, please? Okay, and her tonsils, I would grade those at a +2. Could you smile for me? With your teeth? Okay, and she seems to have no dental work on her, teeth, and her gums seem to be moist and pink, and so that's good. And next, I'm going to be checking her eyes. I'm going to be checking to see if her eyes are symmetric. Next, I'm going to be checking to see if her pupils are equal. So could you just follow this light, or follow my finger? And that was good. And now I'm going to be checking to see if her pupils are round. Okay, perfect. Next, I'm going to be checking to see her reaction to light, which is cranial nerve number 3. Just follow the light for me. Perfect. And now I'm going to be checking the accommodation. So just follow the pen light in. Perfect. And lastly, I'm going to be checking to see if her eyes are symmetric and to see the conjunctivas, to see if her conjunctiva is moist and pink, which they are. So that's good. And now I'm going to be checking cranial nerve number 5 and 7, which is the sensory and motor. Could you puff out your cheeks for me? Could you frown? And could you smile? Okay, those are both intact, so that's good. Okay, so next I'm going to be checking her carotid pulses on each side. I'm going to grade those at a +3. And now I'm going to be checking to see if she has any bruise with the bell. She doesn't seem to have any bruise. And now I'm going to be checking JVD. So could you turn your neck to the left? Okay, no obvious signs of JVD on that side. And same on that side. Okay, perfect. And now I'm going to be checking her upper extremities. So first, I'm going to inspect the overall color, appearance. I'm going to check the temperature, make sure her arms are symmetric, make sure she doesn't have any lesions or masses or any moles. And I would use the same method I would use for her face if she had any moles, the A, B, C, D, E. But she doesn't seem to have any, so that's good. And next, I'm going to be checking her brachial and radial pulses, and I'm going to be grading both of them. So here's the first brachial pulse. And I'm going to grade these at a +3. And next, I'm going to be checking the capillary refill on both of her hands. And they all come back within 3 seconds, so that's good. Next, I'm going to be checking for clubbing on her fingers. And if she were to have any rounding on her fingers, that would be a sign of clubbing. But her fingers all seem to be normal. Okay, and next I'm going to be checking her hand grips. So could you just grab my hands, squeeze them as hard as you can? Okay, perfect. Next, I'm going to be checking her heart, lungs, and thorax. So first, I'm going to be, I'm telling you that this is the aortic, pulmonic, herbs point, which is where murmurs take place, tricuspid, and mitral. And the mitral is where you're going to check for the apical rate for a minute. But for the sake of this video, I'm just verbally going to tell you that I'm doing that. Now I'm going to auscultate her heart sounds with the diaphragm of my stethoscope first. And here's when I would be checking the apical heart rate, but I'm not going to do that. I'm just verbalizing that to you. And now I'm going to be doing the same thing with the bell of my stethoscope, working my way back up. Okay, her heart sounds are normal. Next, I'm going to be checking her lung sounds. So I'm going to be checking them anteriorly, posteriorly, and laterally. 8 in the front, 10 in the back, and 2 on each side. And when I'm checking for these, I'm going to be checking for any crackles or wheezing, any abnormal findings. Deep breath. Again. 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 Okay, now I'm going to check the first lateral side. Deep breath. Deep breath. Okay, other side. Deep breath. Deep breath. Okay, now I'm going to be checking her posterior lung sounds. Deep breath. 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 And one more time. Okay, and her lung sounds are all clear. And next I'm going to be checking the costovertebral angle. So I'm going to be percussing, and if you have any pain or tenderness, just let me know.
No pain.
Okay, great. So now I'm going to have you stand up. And next I'm going to be checking the alignment of her spine. So turn this way, and could you bend over for me? So right now I'm checking to see her alignment, and it seems all good. Could you stand up for me, please? And now, next, I'm going to be checking her 2-to-1 ratio, making sure she doesn't have any signs of a barrel chest. So that's good. Here we go. And next, I'm going to be inspecting her abdomen. Could you just come a little bit closer? Okay. Okay, so first, I'm going to inspect to see if her abdomen is symmetric. Make sure that her stomach is flat and contour. Make sure there's no scars, any lesions or masses or moles. And here first, you have the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. And in the right upper quadrant, we have the gallbladder and liver. In the left upper, we have the stomach and spleen. In the left lower, we have the ureters, the left ureters, and the left ovary. And in the right lower, we have the right ureter and the right ovary. And next, I'm going to be auscultating her for her bowel sounds, making sure that all of her sounds are hyperactive. And I'm going to be checking these in each of the quadrants. Right upper, left lower, right lower. And all her sounds are hyperactive, which is good. Okay, and now I'm going to percuss each quadrant. And her right upper quadrant is going to have a dull sound because of the liver, but all the other quadrants are going to have tympanic sounds. And lastly, I'm going to palpate her abdomen for any pain or tenderness. So you need to let me know if you feel any pain or tenderness, okay? Mm-hmm. Here's the right upper, left lower, right lower. Any pain or tenderness?
No.
Okay, perfect. Now I'm going to be inspecting her lower extremities. So first, I'm going to check and see if her lower extremities are symmetric. I'm going to be checking for lesions or masses. Check her temperature. Check for edema. So right now I'm checking in the temperature. Checking for any edema. She doesn't seem to have any. And again, if she had any moles, I would use the same method I used for the upper extremities and her face, the ABCDE. Now I'm going to be checking her lower extremity pulses. First, I'm going to check the dorsalis pedis pulse on both feet. Now I'm going to check the tibial pulses, which are in the inner part of the foot, on both sides. And lastly, I'm going to be checking the popliteal pulses. And I'm going to grade all those pulses at a +3, which is a normal pulse. Next, I'm going to perform the Babinski test. And both of her feet reacted to the touch of this pen light, and her toes reflexed, so that's good. Next, I'm going to be performing the Romberg test, so I'm going to have my patient stand up. Could you stand up for me? Mm-hmm. I'm going to have her legs spread apart, her hands by her side, and I'm going to have her close her eyes for 20 seconds, and I'm going to assess for any dizziness, any swaying, any abnormal findings. So, go. Okay, and she swayed a little bit, but that's normal. There was no dizziness, nothing else. And now I'm going to have my patient perform the get up and go test. So I'm going to have my patient sit on the bed first, and when I tell her to go, she's going to walk over there and then come back and sit back on here. And as she's doing that, I'm going to assess her gait. Go. She's walking steady. No dizziness, nothing abnormal. So she passed. And this concludes my head to toe assessment. Thank you.